So today we're going to be looking at atherosclerosis and atherogenesis as well, which is the formation of plaque in the tunica intima. So formation of this fatty plaque in the intimal lining of the medium and large arteries. So it is a chronic condition. That means it takes many years for it to develop, and it's a condition of the vessel wall. So you can see that the vessels in atherosclerosis have these plaques of lipid material, which can cause blockage of blood vessels. And here is a diagram just looking at the anatomy essentially of a blood vessel. So you can see the external elastic lamina, the fiber fatty material, which is not normal in blood vessels. So usually you wouldn't find this material in blood vessels, but because of different mechanisms which we're going to discuss today, it causes this build-up and reduces the lumen. And this can occur in different types of arteries in the body, like the internal carotid, coronary arteries, thoracic and abdominal arteries, as well as the renal and popliteal arteries as well. So there are major consequences to this, and this blockage can lead to things like ischemic heart disease from reduced blood flow, and this can be reduced blood flow to the brain or the heart, but just ischemia in general, as well as aneurysms and ruptures due to the weakened vessel wall, as well as thrombosis or an embolism due to blockage and plaque disruption. So, first of all, we want to look at things that individuals can do to reduce their risk of getting atherosclerosis. So, things like dyslipidemia, so elevated cholesterol levels can lead to this, as well as poor diets, cigarette smoking, hypertension, diabetes, and many others. But these can be changed, so you can change your diet, same thing here, reduce smoking, and take hypertensive medication, as well as reduce your salt intake as well, and diabetes as well, take your medication, as well as increasing your physical activity. But non-modifiable factors such as age, sex, and genetic predisposition are things that are obviously unchangeable. So males usually have a higher risk because women are protected by estrogen before menopause. So since the estrogen levels are so high, it basically protects them from getting atherosclerosis. Now let's have a look at the 3 stages of plaque formation. So the first stage is your fatty streak formation. So this usually has no clinical symptoms, but what happens is your endothelial lining of your arteries, so if this is an artery, your endothelial lining in the middle gets disrupted, or there's dysfunction, which is the main cause of atherosclerosis. So physical or chemical insults will cause corruption in the endothelium. And these endothelial cells are a barrier between the blood and arterial wall. So there are common factors that can lead to this, as we discussed, like dyslipidemia, smoking, and all that. So what happens is usually your tunica intima forms streaks in the vessel wall. So there's tunica intima has these fatty streaks in the layer of the vessel wall, and this development can start really early in life, maybe sometimes even in the first 10 years, and it's initiated by endothelial dysfunction. So more LDL, so low density lipoproteins, they come into the intima more often than exiting, and this can cause accumulation of your LDLs in the tunica intima, and basically cause a specific process which we'll look at, but there's modified LDLs, and these LDLs are modified by two things. So they're either modified by oxidation or they're modified by glycation. And these modified LDLs are very toxic, so they can cause inflammation and make nearby endothelial cells really modify them and cause dysfunction in the endothelial cell wall. And this is going to cause, your body's going to be like, there's something wrong, and cause an immune response. So you're going to get monocytes, which are a type of leukocyte, to be expressed. And these monocytes have scavenger receptors which are placed on macrophages. So monocytes will give these specific scavenger receptors to macrophages. And so those receptors are going to be placed on a macrophage. So what's going to happen next? Well, these macrophages that have this receptor can then consume the modified LDL particles. So you'd have these modified LDLs, and all of these are going to be consumed by this macrophage. And but the downside of this is that there is no negative feedback mechanism for these scavenger receptors. And so what happens is, because this macrophage now has so much modified LDLs because of this receptor, so there's so many modified LDLs that are going through, that it creates a foam cell. And this foam cell is usually created by, so it used to be a macrophage, but now it just has so much modified LDLs that we call it a foam cell. And these foam cells then accumulate to form that fatty streak, which can then remain either static or it may regress or progress. So this just depends on the amount of lipids that are coming in. Now, then we move on to the second stage, which is plaque progression. So as we talked about the foam cells continue to accumulate, and we have smooth muscle cells which are present in the tunica media as well as the tunica intima. And vibration of these smooth muscle cells causes them to move to the tunica intima. So usually you find these in the tunica media, but they migrate and they move into the tunica intima. And basically this causes them to migrate and proliferate, and it can protect the endothelial cells that are dysfunctioning, and it basically forms this sort of protective layer against the foam cells. So it creates this fibrotic cap over the necrotic core. So smooth cells become more secretory in nature, and what they do is they secrete the ECF substances like elastin and collagen. And what they want to do is these foam cells, remembering that a foam cell is a macrophage with lots of modified LDLs inside of it. And so these smooth muscle cells will come in, and they want to release these substances like elastin, and also collagen. And these substances help to destroy these foam cells. And they kill the foam cells, and once the foam cells die, they secrete the fat that was inside of them, because remember, they have these modified LDLs inside of them. So this causes fat accumulation in your blood vessels. So there's dead content of the foam cells, which is the fat, and this is present in your extracellular matrix, and it helps to form the necrotic core. Now, what is the necrotic core? Well, basically, it's just debris. It's just a reason, region within your arteries where like all the dead debris is. So it's just a mass of like dying cells. And the necrotic core is bigger in some places than others. It just depends on how severe your atherosclerosis is and what type of atherosclerosis it is. So because we have this necrotic core, it causes narrowing of the lumen. And in this environment, because this environment is so like chaotic, your smooth muscle cells also die, and this causes addition to the debris. Now, platelet progression then can proceed in two ways. There's two ways that this can come about. It can either then form a stable plaque or a vulnerable plaque. And usually when we looked at the first step of the fatty streak formation, this doesn't have any clinical features or any symptoms, whereas this stage, you'd start to get some clinical symptoms come about. So we'll look at the two stages first. Basically, your stable plaque is when you have a small necrotic core. So let's say this is your cell. You would have, this is your lumen. You have a small necrotic core here, necrotic core lumen. And you would have a thick fibrous cap, which is basically just dense ECM. But this lumen is reduced as compared to normal. So, but you do have low inflammation. So this is not as bad of a situation, but it can produce symptoms. Whereas your vulnerable plaque is more dangerous because you have a larger necrotic core. So that means more things are dying, larger necrotic core, and you have a thin fibrous cap. Let's say this is the fibrous cap, and the lumen is just normal. There's no reduction in the lumen, but this can rupture easily because of this necrotic core. And the necrotic core is putting so much pressure on everything else that it can pop really easily, causing the release of fat. And this fat can then accumulate in the blood vessels and cause a thrombus to form and block the lumen of the artery. And then this can, stop blood flow and cause so many other problems. So, but in this type of plague, in vulnerable plague, what happens is you have a small number of smooth muscle cells. But there are some leaky blood vessels which can cause spotty calcification. Now, let's move on. So plague progression was the second step. The third step is plague disruption. So plague rupture or erosion, what happens is this big sort of thing that we had explodes. It just explodes, causing all of its fat and everything to be released. And it exposes those thrombogenic collagen tissue factors, causing thrombosis. So it helps to develop a thrombus, and the junction between a plague and the healthy artery wall is the most common site for disruption. So let's say if we have this sort of thing right here, you have a place in your artery where one side is all disrupted and one side is normal and healthy. And this place is called your shoulder cap of, so the junction between a plague and a healthy artery. So this is usually where this disruption happens. This whole thing basically explodes and releases all of its fat. And it can reduce lumen and sometimes even cause stroke if it blocks arteries. Now, if we look at the beginning, we had your fatty streak form due to endothelial dysfunction. This causes insudation, which is basically when your LDL leaks into your intima and becomes oxidized. And remember, when it becomes oxidized, it becomes toxic and it's bad. It causes an inflammatory response, causes your monocytes to appear, and these monocytes travel and they carry these receptors which can then attach to macrophages and then swallow them and all of that sort of stuff. So your foam cell then forms because your macrophages engulf those LDLs, which are oxidized, so they're toxic, using scavenger receptors, and you get a fatty streak formation. The fatty streak formation is basically due to the foam cells. And now that we've looked at that, we can look at the last stage, which is, plaque disruption. And it can occur either in a rupture of the fracture of the fibrous cap or erosion of endothelial layers. Now, how do we treat this? Well, there's a bunch of different ways. Obviously, lifestyle is a big one. So because this is so chronic, it develops over time. Like, it takes many years, sometimes even decades to develop. And so changing your diet, exercising more, and stopping smoking can help to manage this. As well as, how do we find out? Well, looking at the person's lipid profile, as well as looking at stenotic plaques, as well as molecular imaging to see if there are any vulnerable plaques present. And there are different types of surgeries or medication that can help with this. Antihypertensives are a big one because hypertension can cause pressure in your arteries, and it can cause them to rupture very easily. And the next thing is just looking at lipoproteins in general. Now, there are two different types of lipoproteins. There's HDLs and LDLs. So HDLs are kind of like the good ones. If you look at high density lipoproteins, they remove cholesterol from the arterial walls. And it's not a bad thing to have cholesterol because you need it to form things like the cell membrane, and even you need cholesterol to form different hormones. But having too much can cause a bunch of issues. And so HDLs help to maintain that equilibrium between too much and too less cholesterol, and it helps to move this cholesterol from the arterial walls to the liver, and this is called reverse cholesterol transport. Now, how does it protect the body, basically? It reduces inflammation. So it prevents blood clots, so it's antithrombotic, and reduces cell death in the blood vessels. So reducing cell death means you don't have a lot of those necrotic areas, essentially. So you'd have less of a chance of having a necrotic core because your HDLs are helping to reduce cell death. And a necrotic core is only formed when you have lots of cell death, like smooth muscle cells or macrophages, all dying is going to make that necrotic core bigger. So it's going to reduce that, and these cells are lowered by smoking and obesity. So you can tell why exercise and good diet is so important, as well as stopping smoking to prevent this. We also have familial hypercholesterolemia, which is more of a genetic predisposition, so genetic disorder where your LDL receptors are reduced, and this causes an accumulation of cholesterol in the blood. Now, too much cholesterol is always going to be bad. So it's just that LDL receptor deficiency, and high LDL levels then can cause an early onset of atherosclerosis and heart disease, especially in early ages. So usually, if you have been predispositioned to this genetic disorder, it can cause that to happen in early ages as well. And different endocrine diseases like hypothyroidism, where you have a decrease in thyroid levels, can also cause a reduce in these receptors in the liver, and that can lead to an accumulation of cholesterol. So that's why some of the symptoms related to hypothyroidism can be like obesity and lethargy. So just to summarize, that is if we go back, you can see that the main thing to remember is just like plaque formation and the 3 different steps that are related to that, because it can help us understand what phase the patient is in, and we can identify how to deal with it. Because if it's in the early stages, we can just have modifiable risk factors, like exercise and improve your diet, all of that sort of stuff, reduce smoking, which can reverse those effects. But if it's more in the later stage, especially your plaque formation and erosion, where all of the fat is already in your blood vessels, it's a lot harder to treat, and surgery is probably the best option in that. So that is atherosclerosis.